Welcome to Federation University Australia. I'm Rachel from the International Marketing and Recruitment team. Today, we're going to be discussing public health, the impacts of COVID on the public health sector, and provide you with information about studying our Master of Public Health degree with different specialisations. To tell you more, I'd like to introduce Associate Professor Dr. Mohammed Aziz Rahman, Program Coordinator of the Master of Public Health. Dr. Rahman holds a PhD in public health and has published more than 70 research papers in journals, some of which are highly ranked with more than 10,000 citations. His research has involved collaborations with more than 25 countries globally, including a number of Asian and Middle Eastern countries, Canada, UK, and USA, and he contributed for the success in securing $7.9 million in research funding from the Australian government. Dr. Rahman has been providing leadership in teaching, both at undergraduate and postgraduate levels, as well as in research supervision, both in Australia and internationally, for over 15 years. His experience includes working with multidisciplinary teams and stakeholders, including government and non-government organisations, academics, health professionals, community leaders, and the general public. He is an editorial board member of 2 reputed international journals and the co-convener for the Health Promotion Special Interest Group at Public Health Association of Australia. Welcome, Dr. Rahman.
Public health is a branch of science which promotes and protects health of community people. It prevents people from getting sick or injured and promotes wellness by encouraging healthy behaviors. The primary difference between medicine and public health is medicine deals with individuals and focuses on disease diagnosis, treatment, and care of individuals. Whereas public health deals with population and focuses on disease prevention and health promotion. The term public health became more familiar globally during the current pandemic of COVID-19, when people were concerned and trained on how to prevent the spread of virus. All the steps which we are following for more than a year now, such as hand hygiene, cough etiquette, wearing masks, maintaining physical distancing, getting tested, being in isolation and quarantine, and vaccination, all of these are public health messages. Despite the sad reality of over 120 million cases and over 2 million deaths globally, I will say that COVID has improved awareness on disease transmission and basic principles of public health among general community people. But at the same time, it has also demonstrated the gap and the need for more trained public health workforce in each country, including Australia. If you are passionate for improving health and well-being of the global population, a Master of Public Health program will provide you the basic levels of understanding in this area. It will prepare you to be a public health professional. There are multiple career options available in Australia and globally, including working within the public and private sectors, development agencies, and universities. You can choose to work as a researcher, or a policy officer, or a health promotion officer, or as an academic. Besides, you can also be involved in managing and evaluating public health programs, formulating and implementing policies. You may also pursue further study and complete a PhD. One of the myths for public health is that it is perceived as the program for anyone having a health background only, such as doctors and nurses. But that's not correct. People from multidisciplinary background can bring their background knowledge and experience to think differently about any public health issue and the ways to resolve it. As for example, a journalist can have a better understanding about a public health issue and report in a much better way compared to someone who does not have public health knowledge. A lawyer can understand the issue of public health and contribute for public health policy. An engineer can contribute for public health engineering for any construction-related issue of public health intervention. A nutritionist can contribute for advising on diets for many chronic diseases. Now, why should you choose Federation University Australia for enrolling into Master of Public Health program? If you want to become a leader in public health research, influence global population and health systems in the field of health and well-being, Federation University Australia is providing you this unique opportunity. With a strong emphasis on research, the Master of Public Health will provide professionals from multidisciplinary backgrounds with enhanced skills to pursue a career in public health. A conceptual understanding of public health and research will be developed throughout the first year, and in the second year, individual interest areas will be pursued through one of the 5 specializations, and that's the uniqueness of our program. Depending on your interest, you can choose research on the area that interests you, or you can choose research related to public health informatics, public health economics, or health systems management. If you don't want to do research, you can choose the project specialization. During your thesis in the second year, your academic supervisor will meet with you regularly to ensure you are on track. Our blended learning method incorporating face-to-face workshops and online modules will provide you flexibility to suit your lifestyle, allowing you to get ahead in your professional as well as personal life. Throughout your studies, you will receive individualized support for academic progression according to your need and interests. The entry requirement for the international student is that successful completion of a 3-year bachelor degree or overseas equivalent degree or other university qualification and appropriate industry experience. There is an English language entry requirements, which is academic IELTS of 6.5 overall, with no individual band less than 6 or equivalent. In summary, public health aims to prevent a disease, reduce risk factors for disease, develop and implement an intervention to reduce mortality or morbidity globally. Thank you.
Thanks, Aziz, for that very informative talk and for guiding us through the Master of Public Health details. It's so great to know that students from any background can join the program and that there are different specialisations available in public health informatics, economics, health system management, project, or the research topic too. Just a few more details about the degree. It's completed full-time over 2 years. The next available intake is this July 2021. It's available at both our regional and city campuses. Our regional campuses include Mount Helen, Ballarat and Gippsland, Churchill, and our city campuses are Berwick in Melbourne and Brisbane, Queensland. For the fees, international students pay $22,700 per year, but we have up to $30,000 scholarships available. All new international students are guaranteed 20% off their fees with a Global Innovator Scholarship, and we have accommodation scholarships available too. Head to our scholarships website for all the details. Applications to study the Master of Public Health this July are open. To apply, head to federation.edu.au/international and follow the apply link for more details. And finally, to find out more about the Master of Public Health, visit our website study.federation.edu.au and search for public health. Thanks for joining us today. If you have any questions, follow the links to get in touch with us. Bye for now.